when we can all come together as people of like mind to tackle the challenges that face us today, not only as Africans in the diaspora, but as Africans on the continent. One thing is very clear. As we try to tackle the 7 pillars of development in Africa, that is education, healthcare, infrastructure, power, tourism, agribusiness. Did I miss something, Tarek? Agriculture, education, healthcare, infrastructure, agribusiness, tourism, and power. What is at the center of it all, what is the foundation of it all, is healthcare and education. Sadly, as I've traveled around the country, I'm reminded of a visit to Canada, where the Canadian government had called on the ambassadors from Africa to come and present what they felt were the areas needed for investment in Africa. There were about 9 ambassadors who came, and they gave beautiful presentations of investment opportunities in their countries. But I was surprised at one thing. None of them spoke about education, and none of them spoke about healthcare. And yet, what is development if we don't have a healthy populace? We are taken for granted as healthcare workers. We're supposed to be humanitarian. But we too have our children to feed. And we too are citizens of our wonderful, amazing continent. We must be taken into consideration when it comes to discussing issues pertaining to economic development. So as we enter the era of the implementation of the African Continental Free Trade Area, healthcare has got to be the front and center of that process. Because with an ailing nation, there is no development. Even as companies from around the globe are looking to invest in Africa, they have a checklist of what a country has. That means infrastructure, the level of education for the people in that country, and healthcare. When their own employees are traveling into the continent and they get sick, can they have healthcare? It's a fundamental issue that must be addressed. But quite often, it is relegated to, sometimes I feel like a footnote, because they're so busy paying attention to what they consider to be important. So we have a responsibility to highlight to our beloved continent that healthcare is a priority, that they know. They speak of it, but it's never actualized. Wherein lies the problem. We also are clear of one thing, that development in Africa, sustainable development in Africa cannot occur unless if it starts and includes the African diaspora. The brain drain that has occurred over the years, starting with the brain drain with slavery. I often say to my fellow African Americans, to say, you see, anybody that tries to put you down and consider you as weak, you must remember one fact that you are never told. That for your descendants, for your forefathers, 2-3 generations removed, for them to have made it across the Atlantic, first, those who took the slaves, they took the fittest and the strongest out of the village. And then after taking the fittest and the strongest out of the village, half of them perished across the Atlantic. So you know, the one who made it to the continent, they were truly the fittest. Are you with me? And that's who you're part of. And that's where you come from. Those are the genes that you carry. So don't let anybody ever make you feel that you're inferior, that you're not good enough. You are a hybrid of some very special people. So taking that in mind, we have migration and brain drain that came back 400 years, that goes back 400 years ago, followed by those who crossed the Atlantic in search of greener pastures. The bottom line is Africa has been deprived of the brains that Africa needs to build the Africa that we want. Money alone is not enough to build Africa. The expertise that we need is right here in the diaspora. Healthcare is one such area that I speak about all the time. If all the continental African doctors were to return home to Africa today, if all African American doctors were to return home to Africa today, we're only going to meet about 30% of the need. So no amount of money put into healthcare in Africa is going to deliver the desired results. I like to use an example of my home country by marriage, of course. You know how us women, you meet a boy and you lose your head. For those who don't know, I was born in Zimbabwe, but I'm Ghanaian by marriage, so Ghana is my new home. The president of Ghana, and the one before, they thought addressing the issues of healthcare was building new hospitals, renovating the old ones, building and renovating rural clinics and regional hospitals, district hospitals. But guess what? Most of those, half the wards are closed. There are no doctors. We were doing a needs assessment visit in Malawi. One NGO donated a whole brand new maternity ward, first class maternity ward at the Kamuzu Central Hospital, much needed facility. And as we were touring the hospital, we were on one side of the hospital. I mean, you couldn't even walk through the hallways. That many people. Babies, 3-4 babies in one crib. Patients sleeping on the floor. And then pretty soon we found ourselves on the other ward. It's like when they open the doors, it's like, wow, am I still at the same hospital? Brand new, first class, stocked, beds and all. I said, why are people crowded over here when this whole wing is here? They had no doctors. It was just that simple. No doctors. The story is repeated all over sub-Saharan Africa. I don't like using that, but I use it for the purposes of communicating. We are Africans. They use that to divide us from North Africa, which is wrong. So the reality is, what Africa needs, and for now I'm going to focus on healthcare, but what I'm talking about pertains to every sector, is capacity. Capacity building is where it's at. And that capacity that we need is in the diaspora. There are more Ghanaian doctors in New York City than in the entire country. There are more Ghanaian Nigerian doctors in LA than in the entire country of Nigeria. That is our reality. So you and I, ladies and gentlemen, have a responsibility to assist our continent in building the capacity that we need. You are the trainers. So as we enter the era of the African Continental Free Trade Area, you have a huge, huge role to play. Going home alone is not enough. We must organize ourselves in a way that we can bring true, meaningful change. You must understand that Africa as it stands today, as the African countries that we are today, we are a formula. We are a recipe for failure that goes back to the Berlin Conference. You see, we were talking about little Malawi doing what Malawi can do for her healthcare with her limited capacity. And right next door, we're talking about little Zambia, little Mozambique. And the story goes on. What's needed now, my fellow brothers and sisters, is to look at our continent. And I suggest we look at it from a regional point of view. Picture a perfect scenario where we doctors sit down and do a mapping exercise. We divide ourselves into 5 regions. We have the Southern African region, we have the East African team, West African team, North African team, and Central African team. We then look and say, what is the population of Southern Africa? I'm going to stay with Southern Africa for now. And then when we look at Southern Africa, this is the population. With this population, how many doctors are there in this region for this population? And we break those doctors into the subspecialties. When we finish that exercise, we then say, for this population, how many doctors do we need? This is what we have. How many do we need? Sector by sector. Yes, my people, follow me, right? We're still doing we got a regional team, right? We have a regional team of doctors right here in the diaspora. We then say, for us to beef the capacity, to build and train the capacity that is needed to get us to where we say we have the healthcare workers that we need. At what pace must we train? With a 5-year plan, a 10-year plan, a 15-year plan, and golly, by 20 years, we better have trained all the healthcare capacity that we need. So together, we can say, now remember the educators are doing the same thing. Not only are we talking about training the workers, we're also talking about, as we build the facilities, the physical structures, starting with my favorite, Wakanda. I call it Wakanda because we can't call it Wakanda, it belongs to Marvel, but it sounds good to call it Wakanda. They are African Diaspora Centers of Excellence, where we are saying we are coming home to build the capacity in healthcare that we need. We are going to have one central center of excellence in healthcare in each region. And from this first hospital, the rest of the development for healthcare is going to emanate from that. As we train the healthcare workers from this initial facility, the regional team will map out the expansion process. As we train, we are building facilities. As we train, we are building clinics. As we train, we are building. So we are training the capacity and building the physical structures in a very coordinated way. And that includes helicopters for lifeline, creating of a tertiary care, whether it be initially one tertiary care center in one region, and then we strategize and say the next tertiary care center, the next tertiary care center, with an organized system of feeding patients to specific areas. We all understand that, because this is the environment we're coming from. And we begin to bring sustainable change to Africa. You, my brothers and sisters, are supremely qualified to do that. Does anybody here have any doubts that we can do this? You see, $1 million of us with $1,000, that's $1 billion. We can build a hospital, can't we? 500,000 of us with $2,000, that's $1 billion. 250,000 of us with $250. No, with 250 of us with $4,000. That's $1 billion. Doctors, can we not do this? That's all it takes. We're spending money in senseless ways, simply because we as Black people have failed to come together and speak with one voice. You see, my neighbor back in Tennessee, a urologist years ago, it must be going close to 10 years now, they were having problems. He's Indian, India the country. They were having problems with their family members dying from renal failure. they did not have dialysis centers. So they called on each other, all the Indian dialysis centers and urologists in the country. They formed an association. They also called on their nurses. They said, we are all going home every year. And let's all commit that when we go home, we are going to open a dialysis center wherever you are coming from. That means the doctor and the nurse. You are already going home. Leave something. So it is. They embarked on a process of building dialysis centers in India. Very little changes to their lives now. They mapped out themselves. They would register when they were going home, and they would start mobilizing dialysis equipment to be shipped to India. So when they get there, they open a dialysis clinic. When I came to this mission 3 years ago, they had over 5,000 dialysis centers established. Didn't cost anybody much. They're already going home. And they put aside 3 days to train the nurses, the local nurses, to continue the work. This is what happens when people think alike. When people begin to say, it's about me. It's about my parents. It's about my aunt. It's about my grandmother. It's about my children and grandchildren. That is something that we have failed to do as Black people. We're so selfish. I have a house and a car and a job. I have arrived. No, you have not. You got a long way to go, baby. And that means you got to get out of your selfish cocoon and realize that to whom much is given, much is expected. It's just you. Especially healthcare. People are dying. So we hope, as we meet today, we can take off our selfish hats and realize that the journey to a true, healthy Africa begins with you. So let's deliberate. Diaspora Care has started a wonderful program that I hope we can all support. There's also one other statistic that I need to make sure all of you know, because as I have been speaking, I realize most people don't realize that. Over 50% of drugs going into Africa today have zero bioavailability. People are dying thinking they are taking blood pressure medications, diabetic medications, antibiotics, when in actuality they are taking chalk. These are millions of murders being committed by multinationals, and nobody is holding them accountable. We have a responsibility to change that. So today, I hope, will mark the beginning where we, African diaspora healthcare workers, are going to say enough is enough. That we are sick and tired of being sick and tired. And we can no longer stand by the sidelines while our families are dying. The journey begins with you, and it begins today. Welcome home to the Africa House. And we are a group of us doctors. We challenge these pregnant women who were due any day. They beat us to the game. They ran so fast, it was unbelievable. It's actually shameful. I still have a video of it. It was their way of advancing labor. Those clinics, they almost had 100%, or rather, zero maternal mortality rates. By simply having those rest centers, come on, we're gonna keep you and make sure all those little things that will make you go to the central hospital and end up in the pre-eclampsia ward, done. I could tell you horror stories of the things that I've seen over the years happening in our Africa that are completely preventable. So when Jyote is talking about telemedicine, each and every one of us can make a difference. We can save a life. Just simply saying medication that we get for free in this country. I don't know if we have public pharmacy in this area, but in Tennessee and most of the South, public pharmacy, basic blood pressure medications, diabetic medications, basic antibiotics, they're free. All you have to do is show up with a prescription. And these are the medications that we don't have that are killing over 80% of Africans. We could make a difference. We were in Sierra Leone. We'd been on television as doctors. And then we ended up at our hotel. And there was a man who saw us and said, "Oh, doctors, come on over here, let me buy you a drink." And some of us were there with our husbands, and he was not interested in us women. Some of the doctors were females. And I remember my naughty husband saying, "Well, honey," he was telling the other doctor, "Oh no, if that man is paying, he can have them, you know." So they stayed on one side of the bar, and us women, we stayed on the other. And one of the doctors, like a female cardiologist, so we were telling the guy, you know, what our specialties were, and the guy says, "You know, doc, every now and then when I walk, I get chest pain over here." And he was waiting to go to Japan 6 months later to see his doctor in Japan. So of course, the cardiologist quickly explained to him that what you're having is not a good thing. And he had all the signs of an angina, and someone who could just go to sleep and not wake up, or somebody who just have his last chest pain and just fall over and die, which is what Africans are used to. When you say, "Oh, what did he die of?" "Oh, he just passed out and died." It's accepted as a reason to die. You can make that difference by simply telling this person, "No, you are in danger," via video, telemedicine. I don't know what we need to do to join Diaspora Care in expanding this program. Each and every one of us, we're from some country in Africa. And if we're not from some country in Africa, let's adopt one. Let's begin to say, I'm going to make a difference. I'm going to reach out to the other doctors in that country. We're going to create a network where we can begin to help each other. There's so many low-hanging fruits. Our problem is we're so used to, "Oh, my country." No, it's okay to start with a pilot in a country. Let's all support that country. Let's support that project. Let's get it to be fully implemented and functional, and let's show our leaders that we, the diaspora, are ready to come together. That no more shall we be divided. No more shall we be selfish. That it is about us taking care of each other. Because we can. Because we can. There's a company out of North Carolina for $250. You can sponsor a clinic to have light. I cannot tell you some horrendous stories I've heard. One particular story, I have shared it with others. A woman who showed up at a clinic to deliver. Every African woman who's pregnant knows, close to their delivery, they must pack a little bag. And one of the items they must have in that little bag is candle and matches. So when you show up in the clinic, there's no electricity. At night, they'll have light to deliver you. But this one woman could not afford a candle. Funny thing is, she had matches. She didn't have a candle. And the baby had the cord wrapped around the neck. Because she did not have a candle. The nurse was trying to deliver her using the moonlight. She did not realize that the baby's cord was wrapped around the neck. So the more she tried to use the forceps to pull the baby, the tighter she tied the noose around the neck. Needless to say, the baby did not make it. A simple candle. And this is repeated over and over and over. See, for $250, you could donate a kit to that clinic, and they can have 5 rooms lighted. See, we can do all that when we are together. So what Diaspora Care is doing is creating a platform where we can begin to have these conversations. So I'm asking all of you, if you do anything, be part of it. Be a member of Diaspora Care. And that's where we can converge and have these conversations and begin to make a difference in Africa. The $5 clinics, that's an amazing idea. Look how much we spend over nothing. So the ball is in your court. To make a difference.